Welcome to www.nevada.healthsourcecairo.com/city/Las-Vegas. Today's topic, treating common athletic injuries. Sprains, strains, and other common athletic injuries can be treated with some common sense and some basic supplies. With a doctor's assistance, most basic injuries will heal within a matter of a few weeks, allowing you to get back to your regular level of activity. Neglecting common injuries can lead to chronic problems, something no athlete wants. Sprains and strains. There is no better first aid for a sprain or strain than rice. Rest, ice, compression, and elevation are the standard of care for these minor injuries that most people sustain either at the gym or during their day-to-day existence. The protocol is relatively simple. Rest. During the first couple of days, you want to avoid using the injured area as much as possible. Giving a muscle time to rest can go a long way towards healing. Ice. Apply ice to the area for 15 to 20 minutes several times a day. This helps to control inflammation. Inflammation is not just uncomfortable, it slows healing. So preventing the swelling is good on two fronts. Compression. By wrapping an injured area, you not only help support the injury, you help prevent additional inflammation. Too much compression can restrict blood flow, so use some common sense. Elevation. If at all possible, keep the injured area elevated above heart height. This too helps prevent additional inflammation and assists in draining the swelling already present. Rehabilitation of injuries. Once you get past the first couple of days, you can move on to some gentle exercise to help get your injured tissue back to full function. A physical therapist can help you select and perfect the right exercises for your particular injury. A combination of training with your therapist and work at home will get you moving in the right direction. Minor injuries may only take a couple of weeks of treatment, while serious injuries can take several months of effort. Tears and broken bones. In some sports, tears and breaks are as common as sprains or strains. For such a serious injury, you need medical attention. You and your doctor will evaluate the injury and decide on a course of treatment. Often, in addition to rice, you will need a period of immobilization and either a cast or splint. For some tears, especially in the rotator cuff, surgery may be necessary. After the injury has begun to heal, rehabilitation will be essential to return you to your former strength and flexibility. New surgery techniques are less invasive, meaning that you can start your rehab sooner, and the more quickly you get back on your feet, the less deterioration you will experience. Long-term prognosis of injuries. Both major and minor sports injuries have good long-term prospects with proper care. Fortunately for today's athletes, both weekend warriors and the professionals, extensive research into treatment and recovery of sports injuries have made downtime shorter and healing more comprehensive. While an injury is never any fun, it's good to know that with a little rest and good care, you can get back to what you love to do. To find out more information on topics like this, please go to www.nevada.healthsourcecairo.com/city/Las-Vegas. For more information, go to www.nevada.healthsourcecairo.com/city/Las-Vegas.